A wheelchair assessment is about gaining as much information as possible about a person's needs, their wants, their desires, their function, their balance, stability, their condition, to get them the right wheelchair. The pre-assessment checklist aims to get as much information as possible about the person's current situation. So that includes all the environments they would use their wheelchair in, also looking at their physical status, so their posture, their skin integrity, choice of wheelchair and cushion they're using at that time as well. So the wheelchair assessment involves the clinician with the patient just probing a bit more deeply into the pre-assessment checklist to ensure all the information has been gathered. And then the next stage of the assessment really is a visual assessment of the person in their current wheelchair, how they're mobilising, how they're sat, how their posture is. That then moves into a more physical assessment. Firstly, with the person sat in their wheelchair in their current position, taking into account how they're sat, their posture, how they're moving around, and how that affects skin integrity. And that will possibly progress into a plinth assessment, where the person is assessed in sitting and possibly lying on the plinth. There's a whole range of wheelchairs, from the range of active users to enable 100% independence, right through to people who need a bit more support in their wheelchair, right up to people who need powered wheelchairs or tilt-in-space wheelchairs, who aren't able to shift their body position and relieve pressure. Measurements are taken of the person's hip width, length of the upper leg, length of the lower leg, length of the trunk, and any factors around their upper limb and if they need support from armrests or anything like that. The assessment should also take into account how the person gets in and out of their wheelchair, whether they need to be independently lifting their wheelchair in and out of a vehicle, whether they need any assistance with transfers, whether they're using any sort of sliding board or being hoisted, whether any carers are involved in the transfer process. All of these factors will need to be taken into account when informing and finding the correct wheelchair for that person. The equipment handover will probably take some time for the equipment to be ordered. Once they're all ready to be handed over, the person should be contacted and they'll return to clinic and the equipment is handed over and set up for that person correctly. Part of this process is really to empower the person with the knowledge and the ability to identify any problems with the wheelchair. These needs are lifetime needs, so the person should be supported to make sure that equipment is kept in good condition and used correctly, and also if their needs change, that they can contact the service at any time to be reassessed. Most services operate a repair service that will come out and repair things either in your home or take the equipment into the service to repair them. With a cushion, it's imperative that the cushion is checked on a regular basis. Where the foam is compressing, you feel that there's less foam between your bony prominences and the base of the wheelchair. It could be that if it's an air-based cushion not remaining inflated, or if it's like a fluid or gel-based cushion, that the gel isn't forming and covering the seated area that you want it to cover. So all of these things need to be checked on a regular basis. In terms of skin integrity, a person needs to be able to either be checking their skin on a daily basis or directing others to do that. And any changes around skin tone or integrity need to be monitored very carefully and the cushion checked accordingly. The NHS statutory services have a duty to fund equipment to meet a person's mobility needs, pressure care needs and postural needs. Sometimes people will seek equipment which is deemed to be above and beyond what the NHS statutory services can provide, and for those people who have the resources, there is the option of going into the private market, and the NHS can provide a personal wheelchair budget which can contribute towards that.